Hello everyone, today I have Dr. Anushree Sinha from Sheffield, UK. She's a general practitioner in UK and has handled many fatty liver cases. She's here to help us guide about what the fatty liver disease is and how we can get better or get rid of the fatty liver disease. Before we get started, Dr. Sinha, do you want to give a quick introduction?
Hello everyone, so I'm Dr. Anushree Sinha. I am a general practitioner practicing medicine in United Kingdom for about 14 years now. Today we are here to talk about fatty liver, which we see now very commonly and manage it at various other stages. So I hope that I'm here to try and help answer some of your questions.
Dr. Sinha, thanks again for joining. So one of the questions that I want to start with is twofold, right? One is I was diagnosed with fatty liver a couple of years ago, as you know, and I reversed it. But when I was diagnosed, I didn't think it was that big of a problem. My doctor didn't think it was that big of a problem. So the question is it a big problem? Why is it a big problem now? Is it something, a new phenomenon that is happening in the world right now, or has it always been there?
Okay, so that is very good question. So fatty liver has emerged mostly now. I would say that it is a condition of the modern day world, and this is because obviously there are a lot of conditions that has come up along associated with the lifestyle that we are having at the moment. So there are a lot of cuisines we are trying. Diabetes used to be there, but nowadays obviously it has been difficult to actually manage diabetes as well, with regards to obesity coming into picture, how much insulin resistance people have got, and the other sort of comorbidities like high cholesterol, which is difficult to manage, high blood pressure, which is getting difficult to manage. And most of it, you can actually link it to the lifestyle that we have got. So taking a lot of fat in the diet, enjoying traveling to different countries. And obviously the diet is one of the things that no matter how much healthy you want to be, but if you're traveling, you love food, then it becomes difficult to control and make sure that you are actually being healthy. And also sort of exercise goes away as well. So that is why we are seeing a lot of fatty liver now than before.
Okay, so let's take this a little bit deeper. Right, so why should I be worried about it? Liver is supposed to be a self-healing organ, one of the only organs of human body which is self-healing. So if liver is self-healing, then why should I be worried about? And what is the end game? If I don't fix my fatty liver, what is the worst that can happen?
Okay, so like you said, obviously liver is a reversible organ, yes. So it regenerates by itself. It has got one of the lovely properties that if it gets damaged, then it reverses itself, which is good. So if you imagine like a rubber band, you keep pulling at the rubber band, yes, and then sort of leave it, then it comes back to its position. That is how the liver is. But if you stretch the rubber band to post an extreme level, then it is going to break, isn't it? It's not going to come back to its position. So similarly with liver, at certain point, obviously, if it is stretched over, it is going to come back to its normal position, starts working, and that's where the reversibility is there. But if obviously we stretch it to an extreme where the elasticity goes away, the scarring comes in, it is more likely to actually break in the sense that it can damage, yes? And damage is in the respect of shrinkage of liver, where obviously the function of the liver goes away. And liver is such an important organ that not only it helps in the absorption of food, fats, but it also helps with lots of other functions of the body as well. So all the medications that you are taking goes past through the liver. It also helps with the general well-being of your body. Bleeding factors, clotting factors, all are manufactured in the liver. So obviously, when we are thinking about letting the liver go, we are probably talking about letting the life slip away.
Thank you, doctor. And it's safe to kind of imagine that if your liver gets to a condition where it cannot reverse itself, the only option we have left is liver transplant, and there is usually a big queue for liver transplant. So if you don't get there in time, or you don't make your top of the queue in time, then you have only one liver in the body. That may be end of life. Is that right?
This is correct, exactly. So like any other transplantation, first of all, there are lots of complexities with any transplantation. First, obviously, we need to see a match. And however, obviously, it is not a problem of Asian or Caucasian or whatever population. It is that we need to match one organ with the other organ so that it can sustain in another body. Organ donation is also one of the problems because we don't have enough liver donors as well. So we would like to diagnose it at a very early stage and then try and reverse it, hopefully trying to prevent that kind of a level when we have to think about transplant.
Thank you. So let's talk about diagnosis of this liver disease. From what I understand, there could be many symptoms that are related to liver, but also very common with other diseases. So it's very hard for somebody like a patient who may have fatty liver to really predict they have fatty liver. So how does it get diagnosed, and what kind of conversation should one have with their doctors if they feel they may be suffering from fatty liver?
Okay, so that is again a very good question. So usually in early stages of fatty liver, you may not have any symptoms at all. You may actually go to the doctor for a completely different problem, like you are feeling generally unwell, you're feeling tired, or you're feeling a bit of a tummy trouble, and then they run a few tests like your blood test, which is the main and the basic one, where they might find that you have got high cholesterol or high glucose, and they may actually find that you have got an abnormal liver function test. And that's when obviously the whole process starts as to what might be causing this abnormal liver test. Or obviously if it is a very high cholesterol, then we would actually go into what we call as further checks, because cholesterol is one of the factors that can affect various other organs like heart as well as liver.
So what are some of the other tests? So once we figure out like there is a possibility that you have fatty liver, how can we make sure we have fatty liver, and what is the seriousness of the issue?
So some people than others will be at high risk of developing a fatty liver. So the risk factors of developing a fatty liver would be people who are overweight, people who have got type 2 diabetes, who have got high blood pressure, or obviously problems with their kidneys, long-term problems with their kidneys, not short-term problems. And some people may have insulin sensitivity like PCOS and things. They are more likely to actually develop fatty liver as well. So when we think about that, you can be at risk of it, or obviously the first test that we have said to run like blood tests, and that shows that you have got a little bit of abnormal liver function test. Then we need to do some further tests to actually see and confirm whether it is definitely fatty liver or whether it could be other conditions that can affect liver in a similar way. So we go on to do ultrasound, which is the jelly scan of your tummy, which shows how the liver is. And in that ultrasound, we get very classical appearances, which confirms that you have got fatty liver. Then, obviously, once we confirm that it is fatty liver, we need to diagnose as to what stage of fatty liver we are in. Because the ultrasound will not be able to give you the severity of fatty liver. It might just tell you and confirm that it is actually fatty liver. And so the further test is to try and understand as to what stage of fatty liver you are in. And that's where obviously the Fibroscan comes into the picture. The Fibroscan will be able to tell you the amount of fibrosis or the amount of scarring of the liver, which is equivalent to how much liver is reversible and what stage we are in. Because obviously if the reversibility is not much, that means the scarring is more, then the chances of reversing will be less.
Let's talk about some of the treatment options for fatty liver. The way I understand is there is currently really no medication. So if somebody is diagnosed with fatty liver, we already talk about like take it seriously, don't let it go because the repercussions are bad. What is some of the things that you would recommend that people immediately start on that journey, and how long does it usually take in your experience to get results?
I'm glad you asked me that question, because this is where obviously us as a general practitioner in United Kingdom come into picture. So we try and help people when we first diagnose them on fatty liver. And actually taking that first step is very, very important. No matter what stage of fatty liver you are in, these steps and these changes will still help towards your condition. The main management is all about lifestyle changes. So making sure that you are improving your diet, taking less fats in your diet. I know this is very easy for me to say, don't eat fats, don't eat oil, don't eat butter, but it is very, very important. And I cannot say that there is an alternative to it. Okay. So you have to make sure that you're using sort of the right amount of oil. The right type of oil is also very, very important because some of them will increase your cholesterol. Some of them are quite good and they will help process the cholesterol that you have already got. So dietary changes are very important. Eating more fruits, vegetables, salad, less amount of red meat, that will help to lower your saturated fats in the diet and lower your cholesterol. Again, it is very important. You can also take the help of the dietitian, and that's what we advise over here, because sometimes it is really difficult for all of us to understand as to what to eat and what not to eat. So obviously, if you are diagnosed with fatty liver, you can get the help of the specialized dietitians. Then the second thing, again, it is not an alternative to diet, is exercise. Okay, exercise is very, very important. There is nothing secondary to that. And they usually recommend that about 30 minutes of moderate to high intensity exercise, at least 3 to 4 times a week, is really, really good. And that will help you to sort of lower your cholesterol, lower your weight, which will put less pressure on your liver and hopefully help to reverse the liver changes as well. That is also very important. The other things that can increase the amount of cholesterol is alcohol. So for the purpose of today's talk, we are not talking about inflammation of the liver because of alcohol, but obviously reducing it because a lot of alcohol is actually converted into fats as well, getting deposited and increasing our weight as well. So reduce the amount of alcohol and stop smoking, which can actually irritate the liver lining as well. So these are the 4 things which I would say is very important in the management of fatty liver.
So let me just recap. A good diet, exercise, they are not interchangeable. Diet and exercise have to go together. Reducing alcohol or completely stopping it, and also stopping smoking. All of them go together to improving the fatty liver. Now, one another thing is, let's assume that I reverse my fatty liver today. Does that mean I can restart my previous lifestyle, or this is a lifestyle I need to continue?
It is again, it's a difficult question, isn't it? Probably most of you know the answer already. So you have done so well to actually control your weight, reduce your weight, have a healthy lifestyle, and probably sort of started to living life or enjoying life in a better way. It is important to continue that way, and that is why I would say that you should make changes which you can incorporate in your lifestyle, not sort of going to crash dieting, different kind of diets and things like that, which is not sustainable. Okay, so sustainability is the key over here. A little indulgence here and there, it is not going to harm, but obviously what harms is a persistence of that indulgence that would lead to further damage. So it is not of a complete reversibility. It can come anytime, or if you have done overindulgence and persisted with it.
Thank you, Dr. Sinha. And personally, I have felt that whenever I've gone to that, reverse my dieting and exercise habits to the old, it has been even harder to come back to a better lifestyle. And I faced an injury where I had to kind of give up on my diet and exercise, and it took me a couple of months to get back on the wagon, if that's the right phrase. Thank you so much for your time today. Really appreciate it. Hopefully we can talk to you again and get more inputs on how to improve the fatty liver.
That's great. Thank you so much. Keep up with good changes in your life, because not only it will help with your fatty liver, but it will help in sort of a general lifestyle and hopefully our way towards a good life ahead.
As Dr. Sinha just said, fatty liver is something that was taken lightly in the past because it used to be almost non-existent condition. However, in the past few years, it has exploded because of fast foods, bad eating habits, low exercise, sedentary lifestyle, and all of those things, including an an increase in alcohol consumption, and there is yet no medicine to actually treat fatty liver, so it has to be done through diet and exercise. I hope to bring you more videos on how to improve your fatty liver. Please do not forget to like and subscribe to my channel. Thank you. Hopefully this has helped, and we'll keep bringing you new videos. Bye. Bye, Dr. Sinha.
Bye.